Hi, I'm Jessie Gruman, President of the Center for Advancing Health. Those of us with one or more chronic diseases have this in common. We all have more than one doctor. I have 9 specialists in addition to my internist, for example. That's a total of 10 doctors, and I've seen each of them at least twice in the past year. Not one of my doctors has ever communicated with another. They don't exchange test results, they don't consult on new diagnoses or fire off emails about my care. I am the sole arbiter of who gets what information, in what format, and when. This cannot be good. Fortunately, there are now considerable public and private resources directed to addressing this problem. One major strategy is to ensure that doctors can communicate with one another easily through use of electronic health records that can be read by any authorized physician. This year's federal stimulus package provided $19.5 billion for health information technology, specifically for the development and implementation of electronic health records in communities across the country. This infusion of funds will undoubtedly accelerate progress in the coming years. Systems are going to become cheaper to install and easier to use, and younger docs are likely to insist on them. But we could get a 100% increase in the number of practices that use an electronic health record within 3 years and still not even have half of the practices in the country using them. Only 17% of physicians reported having any kind of health records system, according to a 2008 survey published in the New England Journal of Medicine. The second major strategy addressing this problem is to offer people help with storing their own health information in protected online personal health records. Google, Microsoft, and newcomer Kias, among others, offer elaborate websites that have the real potential to help people like me who live with multiple chronic conditions keep track of our very exciting health lives. These tools could help me organize and understand my test results, x-rays, lab work, medications, whatever. But the personal electronic health records currently available require that I enter each new piece of information in them, which is a huge initial barrier, though not insurmountable. Unfortunately, however, the fact that not one of my physicians is either willing or able to look at this record means that I am still responsible for the communication of all my test results and other information among my physicians. Until the audience for my personal health record includes my doctors, using an online personal health record is merely an exercise in typing. And so, we patients are caught in this funny wrinkle in time. We're trapped between the practices of the past and the promises of the future. I, like others, make it my business to coordinate all my health information because I think my life depends on it, which is a frightening thought given my attention span and my lack of medical training. But many of us don't realize that our physicians are not communicating about us. A lot is known about the cost and safety impact of poor communication among physicians, but so little attention has been paid to the burden and risks that this poor communication poses for those of us who are living with multiple chronic diseases, and what could be done to alert us that we have to attend to this and to help us to do so effectively now.